So as we transition to the safer at home order in Colorado, many high-risk people like those over the age of 65 or with chronic illnesses like heart disease, they're wondering how they're supposed to get back out into the world safely. Some of them have to leave homes for circumstances that simply cannot be avoided. Our 9 health expert Dr. Payal Kohli joins me now to talk about things you can do to make sure that you are doing things as safely as possible if you are in one of those high-risk groups. So Dr. Kohli, what happens if you are sick or in one of these groups anyway, and you need to go to see a doctor or have a dentist appointment? Is there a way to do that safely?
Yes, there is, Tom, and this is an important one that we can't really avoid. So I have a few tips that people should keep in mind. The first is to wait in your car and actually have the doctor or dentist text you when they're ready for you so that you're not waiting in the waiting room. The next is to make sure that everyone you come into contact with is actually wearing an N95 respirator and a face shield. And this is especially important at the dentist. And if they're not wearing it, I would say turn around and march right out of there and go to another dentist. The third is to actually ask the assistants to disinfect the equipment in front of you. I would also say try to get the first appointment of the morning so that there's less likelihood that someone's particles may have been aerosolized right before you. And then finally, you want to keep talking to a minimum, and you want to make sure that you're just in and out as fast as you can.
You'd like to think doctors and dentists' office would be very amenable to all of that. What about high-risk people who have to return to work? What should they be doing?
So this is another important one because some of us can't help it. We do have to go back to work. So make sure your employer has a mask policy for everyone. Put your desk at least 6 feet away from everyone else. Try not to congregate in the lunchroom or the hallways. I would say take meetings from your desk if you're high risk. So you don't want to be sitting in a conference room that's closed with the air conditioning blowing if you're a high risk person. Clean your station at least twice a day. And one that I want to spend a few minutes on is the public restroom. So when you go to the restroom at work, it's really important to keep a few things in mind because there was a study out of China that told us that COVID-19 patients, their restrooms actually, when they pulled the flush, aerosolized the particles up to 6 feet in the air. So try not to go into the stall immediately after somebody else. Make sure you put down a toilet seat cover or toilet paper if you're sitting down on the toilet seat, and then make sure to wash those hands really thoroughly because you're touching handles and doorknobs in the bathroom.
All right, haircuts. I know many people have been dying to get back to get their hair cut, styled, whatever. It might not be an important thing, but if you're going and you're high risk, what can you do to protect yourself?
Yeah, social distancing is impossible when you're getting your hair cut. So make sure you're wearing a mask and the hairdresser's wearing a mask. Make sure the hairdresser washes his or her hands in front of you. And if they're wearing gloves, don't have a false sense of safety because you have to make sure it's a fresh pair of gloves. It can't be a pair of gloves that they've used on somebody else. And then the other one that people sometimes miss is make sure the combs, the brushes, and the scissors are really well sanitized with something. And then finally, when you get home, make sure you wash your face in case they've touched your face.
All right, good tips to try to keep everybody safe, especially those people who are at higher risk. Dr. Payal Kohli, good to see you. Thanks.